Yeah, good afternoon once more. I'm talking about sickle cell disease, things you should know about sickle cell anemia. It is also called SCD. That's the sickle cell disease. Sickle cell disease or sickle cell anemia is one of a group of inherited blood disorder. Sorry, I'm fast in talking, so I'll just be saying it small, slowly, so that we'll be able to digress. It's one of inherited blood disorder known as sickle cell disease. That's SCD. It affects the shape of the red blood cell. It is caused by a change in the gene that takes the blood to make that takes the body to make iron-rich compound in red blood cell. That's called hemoglobin. It is caused by a change in the gene that takes the body to make the iron-rich compound in red blood cell called hemoglobin. So hemoglobin enables red blood cell to carry oxygen from the lungs throughout the body. So now we have the symptoms of the sickle cell disease. What are the symptoms? What are the complications that are involved? But before then, let's go into reason why it is called inherited blood disorder. That means it is being inherited from the parents. We have in genotype, we have genotyping, the phenotype, we have the AS, we have the AA, we have the AC, we have the CC, we have the SC. SC is also type of sickle cell anemia. Now, AS, genotype AS gets married to genotype AS. Unfortunately, they will give birth to a sickle cell anemia. That's the SS. It can be avoidable, yeah, it can be avoidable very well. But the thing is that when we are falling in love, I think I've shared some of my videos in Tonya Stevens Empire. That's my other page. I talked about, the sickle cell, the genotype. I talk about the genotype. If you go through, you see where I talked about the genotype, of which I'm going to still talk about genotype again. But I just say, let me just share this sickle cell. Please, if you should marry, you are AS and you want to get married, please, no matter how you fall in love, when you get married to AS, you will fall out of love, seriously. Because by the time you're taking that kid to hospital, you are in and out, you're always, we have a lot of that in our facility, a lot. And they were like, I did my genotype, and they told me AA. I did my genotype, I knew it was AS, but I thought God is going to do it. God has already given us that wisdom. God has already given us that grace. You can choose who you can marry. You are AS, my dear. Don't go for AS. No matter the money, no matter what the person has, no matter the love, because when you start having, I'll have a patient, her 3 kids are all SS. Unfortunately, she's still pregnant again. Believing, God, yes, we believe God will do it. But then, when it was chance, as in God has given us that chance for him to do it, we now said, because I love this guy, because this guy is rich, or this guy. No, you don't do that. Seriously, you don't have to take chances. You don't have to dare God. So AS, marrying AS, of course they will have, it's not as if they're not going to have AA. If you do the diagram, you see that they will have AA. they will have AS, but then it's just probability they will have SS. So that is why it is inherited. That is why the SS is inherited. The patient takes the S from the mom, takes the S from the dad. What will we have? SS. So please, for us not to make that mistake, no matter how you fall in love, please, my dear, don't dare God. It's only grace. Some people will be AS and they are fortunate. I have somebody, she's AS, the husband is AS, and their kids are AA and AS. They stopped. They didn't start giving kids again, giving birth again. They said, okay, they are good. They have a boy, they have a girl, and they are good with that. So we have the symptoms. Oh, those living with sickle cell disease, they suffer a lot. I mean, when I see them, I feel pity. I feel that their pain. I feel what they are going through. Sometimes they will stay in the hospital 1 month. Sometimes they will stay in the hospital 2 weeks. Sometimes they will, And let's talk about their PCV. Some of them, they have PCV of 26 and it's normal. And they are okay. They are fine. That is their normal PCV. Without 26, before I entered this profession, let's say before I got deep into my profession as a lab scientist, I will see a patient with 26. I'll be like, hey, Jesus. And the person is SSO. But we have not really gone deep into the profession. We don't know that if this person is having 20, it's good. Do you understand? Then that was then. So their trauma, what they pass through, their complication, oh my God. They fall in and out. Is that what you want to wish for your child? Is that what you want to wish for somebody you brought to this world? Do you want to be in and out? It will drain you. Emotionally, it will drain you. Financially, it will drain you. Even spiritually, it's going to drain you. Seriously, because you keep on praying. You know what you're praying for. You already know what you're praying for. So my lovely people, don't make that mistake. Don't ever make that mistake. If you are AS, please, if you're supposed to be husband is said is AA, please go and recheck. I've seen cases that the woman is SS, thanking God, I've gotten someone that is AA, not knowing the man is even AS, and the man didn't do. And in the lab, most of us, they make mistake. Even where I work, you tell them 3 days for their genotypes. Hey, I went to this lab, they did it 1 day. In fact, they stayed 1 hour, they did it. Because sometimes machine can fail. Sometimes the current that is coming to the machine that you're doing that genotype can fail. And because of, this patient is disturbing me, let me just give this patient. No. I'm begging on my colleagues. When you're not sure, no matter, this is my 20 years as a lab scientist, no matter how busy, no matter how terrible that sample is, do you know what I do? When I do it, I cross-check and I still do it again. Do you know what I do? I'll send it to our other lab. Please, I'm not convinced with this result. It is not as if I don't know what I'm doing. Genotype can mess you up. Genotype is a test that will degrade you. Genotype is a test that can even sue you as a medical lab scientist. Seriously, it can even sue you. So please, let's not make that mistake. They have complications. Yeah, they have complications a lot. The anemia, because the sickle cell are short-lived, or they destroyed at any particular, their red cell is always destroyed. Any particular available, they'll just destroy. They have pain, their crisis, they have their own pain, their own crisis. They have stroke too, and some of them have jaundice. You can see, I've seen patients, I don't know their status, their genotype status, but if I see them, this patient is sickle cell anemia, or sickle cell, is having sickle cell disease. When looking at their eyes, they have this yellow coloration. Their lips, they have this yellow coloration too. I'll now ask, sorry, what's your genotype? They will know that this person knows already. I have a friend like that. She told me, no, she's not ASS, so that she's AA. That her mommy said she's AA. I was wondering, I was like, who does that? And that she has not been sick before. Maybe she was hiding, I don't know. But when I saw her, I knew she is, you know. So, they have yellow coloration and the rest. Their HB, hemoglobin, their hemoglobin is abnormal, which causes the red cell to become hard and sticky and look like the C shape. When you check, if you look at the microscope, if you look under the microscope, you will see their red cells is always sickled, as in a C. That's what is called a sickled form. The sickle cell, their cell, they dies up early, which causes constant shortage of red blood cell. That is why you always see them, they have a shortage of red blood cell, because they die immediately. Not on a normal ground. A patient with AS, a patient with an individual with AS, an individual with AA, just like that. And we have types. We have the SS, that's the sickle cell anemia. We have the SC, that's the sickle cell hemoglobin C disease. Then we have the sickle cell beta plus thalassemia and sickle cell beta zero thalassemia. Those are the types of sickle cell that we have. And we advise them because they're always dehydrated, let them take more of water to stay hydrated. Some of them, they live, I think I was reading one journal. The woman lived for 89 years, and that was a good one. That was a very good one. I had this colleague of mine. I never knew. Oh, may his soul rest in peace, Frank Okuzo. I never knew this guy was a sickle cell patient. Very hardworking. He wasn't behaving like one. But the thing is that I've never seen his eyes before, because he's always wearing dark shade. So I've never seen his eyes. I thought, we feel that out, Not until I knew that when he died at at the age of 52, there was sickle cell. Thank God he's married and he has kids, 2 boys. So, please, what do I tell you? Check your genotype before you get married. Don't put that innocent soul into pains. Don't put that innocent child into trauma. Don't frustrate that child. Don't make that child to have psychological problem. Oh, why will my parents bring me to this world when they know? Please, if you have done your genotype and it's AS, and your spouse tell you that it's AA, please go and recheck. Take that pain. It is for your own good, because you are the one that is going to suffer it. I and other people won't even be there when that child will be passing through pain, through crisis. So I want to tell us that, please, go do your genotype if you have not done, and do have a lovely day. Bye.